Hello, everyone. Well, I'm very excited today. I have someone very special with me in the studio today, Dawn Wiliams, who is one of my Neurocycle certified facilitators, and she's also a fully qualified counselor, lecturer, an amazing person, and helps so many people with their mental health. And we're going to be talking about all things counseling, trauma, the neurocycle, neuroscience. It's going to be an amazing discussion. So welcome, Dawn. I'm so glad to have you in the studio with me today.
Oh, thank you. Such a wonderful welcome, too. I'm really glad to be here, for sure.
Well, you've been working with us for the last 2 years, but you've been a counselor for many years, and you've got a very interesting journey of how you help people. So I'm going to hand over to you to introduce yourself a little bit more about who you are, what you do, and how you got connected with us. And then we're going to dive into all things trauma and all kinds of amazing things.
Yes, that sounds perfect. So, like you said, I have years of experience, and I actually started as a social worker. And so I became a licensed social worker, and I worked in child protection in Canada as well as the US. And where I investigated abuse and I worked with victims of abuse. I also testified in court for that. And I worked in a hospital setting where I was on the trauma team and helped individuals were there. And that's actually when I decided, you know what? I want to do more. So I went actually for my master's of counseling at that time. And then I also worked with victim services where I was called out for victims of violence and helped them actually in that setting, as well as I worked for the Red Cross where I was being called out for victims of shootings and fire.
Wow.
And so I worked closely with victims as well.
Wow.
And then when I got my counseling license, I started to work with families that they had foster children in a residential program and they were being released. So I went into the home and helped that. I worked with the federal program for sex offenders. I provided individual counseling and group counseling there. And I also worked with custody evaluators and being a court-appointed advocate. And then in my private practice, which I've been about 17 years, is I work with individuals, couples, families, and specializing actually in trauma, anxiety, depression, interpersonal conflicts, eating disorders, and co-parenting. And then just most recently, I became an adjunct professor for the South Dakota State University's Masters of Counseling program.
That's amazing. It's quite a journey. And then the last 2 years you've been involved with us as well. So
yes. And so I want to talk about how I came to get involved with you. So I lived in San Antonio and Texas. And about 8 or 9 years ago, my husband said, hey, there's this lady talking about the brain at one of the churches. So he says, I think you'd be interested. So it was actually at the Christian Family Church in San Antonio is where I heard you.
Years ago. Wow, that is going back a few years.
Yes. And so after hearing you speak, I got excited. And so I started to read your books. You didn't have Cleaning Up Your Mental Mess at that time. And I went and actually received more training on how to retrain and rewire the brain. Then I actually started implementing the neuroscience education portion into my counseling practice. And I found that, I needed just something a little bit more skill-based and training to put it together. And so I was actually supposed to I was all set to go to neurofeedback training. Mm-hmm. The night before I was completely packed, my husband got COVID. And I was so bummed. But a couple months later, something popped up on my screen, and it was for your training to become a certified facilitator. And I'm like, that's it. So it was absolutely meant to be.
Oh,
that is how I got aligned with you and this program.
That's amazing. But that's really exciting. I didn't actually realize that you were going for the neurofeedback training, which is so applicable because all the research that this neurocycle is based on, we use the QEG and we're building that into the app and everything down the line. So that's great that you have that interest. But you've got an
Interesting.
amazing background, though, Dawn, with working with victims and first responders. And I mean, that is like hectic stuff and abuse. And you really
Yes.
dove into the deep end of, really harsh trauma stuff. Tell us
Yes.
a little bit more about just that experience.
Well, that experience actually, it's interesting because people would ask me all the, how can you work with sex offenders? And I said, you know what? They made me a better counselor for the victims because they too are a victim themselves. I'm not rationalizing or justifying of their actions, but it helped me to really get into what I needed to do to help the victims. And then, just being involved in child abuse and being there for the kids. And I always feel that the root cause, right? So we talk about being diagnosed and diagnosis. And the only reason I have to diagnose is because when I use insurance.
Exactly.
So it's a code. But I always say there is the root cause of that diagnosis. And so that has always been my go-to working with clients in my counseling field. And, when I was called out to, especially victims of violence, and they were, it was domestic violence, just being able to support them and normalize, their feelings and just make sure that they felt safe.
That
Was really important.
must have been such an emotional experience as well, but to be able to actually have the tools to help them and to be able to know what to do.
Yes. And, once I completed the Neurocycle training program, I realized, and this is what I just truly believe in, is your program heavily aligned with my mission of how I approach my clients and what I believed worked for change to happen. And those included, interesting enough, is becoming aware,
Yeah.
acknowledging and accepting what's going on, but at the same time having the understanding of the root cause of their behaviors, thoughts, and feelings. And then by teaching them and giving them the tools for change to happen. So when I was at your training, I'm like, yes, this is it. And so having the additional lens and integrating the neuroscience and your program into my professional counseling practice has been, life-changing, amazing. It has for my clients, and also being one of your certified neurocycle facilitators has been so rewarding because I see the changes as my clients go through the 63-day process.
And we see that from the feedback that they give us. It's incredible when they just, the feedback that you change their lives, and just having that the guidance and the connection with you, but having the process to go through. So that's what I wanted to talk to you about. So you've got all these years of experience. You've got all this incredible hands-on experience with some of the worst situations that can happen to humans.
Yes, very much.
Had all the training and masters and you now lecture, which is so amazing that you can take this through to the next generation, which is so important. What is it that, when you and I've had these discussions, but I'd love you to share with the audience, what did you feel was missing in the traditional counseling, that you felt like you needed the neuroscience, you needed this more of a process and time frame? And
right. Great question.
Because
first off, what I found most importantly is, we don't want to just change a thought. So what I felt was what was missing is actually changing the neuroplasticity and rewiring the brain. So it's, again, the number one toxic thought that I actually get from most people is, I'm not good enough. And just so telling them, well, you are good enough isn't good enough. So that's where I just want to discuss a little bit about the neuroscience informed approach. also referred as neurocounseling, which integrates some of their principles into the counseling process. And I'm going to show you how I brought your information and the 5-step mind management into that process. And so the three, they identified 3 methods of integrating neuroscience into the counseling profession. And the first one is the neuroeducation. Essentially psychoeducation about the brain and the nervous system. Well, I feel the most helpful tool, which is scientifically evidence-based, is found to be helpful, is your 5-step mind management program, the Neurocycle app, the 63 days, and cleaning up your book, cleaning up your mental mess. I always get my clients to start at the back end of your book, chapter 6, and then go, because it'll make sense, because I really want them to really hone in into those concepts, which is your 5-step mind. Yes, that is it.
That's the Neurocycle app, which is available on iTunes, Google Play, and there's a web version.
Yes, which I have been implementing and bringing in to my counseling practice. And your information has helped my clients to actually really understand the neurological process that underlines their symptoms, which have been proven to improve their outcomes of them getting a better grasp on the neurological process, which is underlying the mental functioning. So that was the first step. The second method, which they believe is useful, as you know, is the use of neurofeedback, which has been recognized as an effective treatment in which changes the brain waves and patterns to aid in the treatment, such as anxiety, depression, and addiction. However, what I found was neurofeedback can be very expensive. It's time consuming. And a lot of times it's only assessing the brain waves. Okay. But what it doesn't teach is the skills that need to be acquired to change one's thoughts, behaviors per se, and rewire that neural pathway. Mm-hmm. So what I found is I've brought in your 5-step mind management program, that your concepts that are throughout your app, the Metacog as methods which are proven, we know, to help clients change their function of their mind, brain, and has been proven, and which you've done so much research on, is reducing anxiety and depression immensely, and also is easily accessible and can be done on their own. So the third method teaches and practices, of that neuroscience that I've brought in is mindfulness, mediation, meditation, imagery, metaphor, and to engage clients more experience, right? To provide behavioral changes. Well, all of those are in everything that you bring forward, especially your 5-step mind management program, and specifically your 63-day Neurocycle app. And so processing that, so by implementing all of those things, has helped me to uncover and gain a new understanding of the client's issues, but also help them to understand it. Which then improves the quality of outcomes and decreases their anxiety. And again, what I believe is getting to the root of the issue. And most importantly, which, like you asked me, well, what is missing, which is changing the way their mind and brain are wired, where you don't typically get that from maybe just doing dialectical behavior therapy or acceptance commitment therapy or CBT. So I really have seen a huge change in my clients, the outcomes of going, oh, okay, this makes sense, and I get the same response every time I work with someone as their certified neurocycle facilitator, or having them do this approach in my counseling, is this is life-changing. It's not just that I'm changing really a thought, but it's ingrained and it becomes from my core belief, which you know, Dr. Leaf, is a lot of individuals' core belief is I'm not good enough. So everything comes through, right? Filters through that belief system. And non-consciously, they're actually repeating it. And so nothing can be refuted. And so just trying to look at the root cause and just kind of trick, that's not going to work. You actually have to change the way that core belief becomes by reconceptualizing. And I've just seen, wow, this makes sense, because this is what I typically get with clients. They go, I've been to counseling lots, and I just sit there and I vent and I rehash past information. But what they weren't getting was some of the understanding, which I think is really important, right? But also linking into acknowledging what's happening because of their past. But then most importantly is the tool for changes. And so that's why I align with your 5-step mind management and the neurocycle, because it does change. It has really changed how my clients think and how they move forward. And you can see it as they're rewiring it, especially when I work with intensely with the clients that come through the neurocycle.
So beautifully explained. And, you think of it, the word doctor means to teach people to understand. You know that it actually means, and
really?
I think yes. And I found that fascinating too. So what's missing from, I believe, the current approaches, because I'll train in the background, both of us have the same it's a similar background in therapy.
Yes.
Is the fact that if you just give someone a technique, and you mentioned ACT and CBT, and dialectical behavior therapy, we're not saying that any of those are wrong. They all play. Every single therapy out there plays a role. But the thing is you've got to, a person's got to have, from my understanding, and I'd love you to comment on this. I'm just going to give you an idea. You stimulated a thought, and I'd love us to just dialogue about this thought.
Okay, great.
The thought is that if a doctor is there to teach a person, that's what it means to teach. So if you are a medical doctor and you're diagnosing a problem and you're giving a medication, you need to explain what the problem is and why they need the medication. You need to give knowledge behind it. You can't just say, do this. Because if you just say, do this, that's not going to work. And the research shows as well, if you want to really empower people or put them on a pathway to empowerment, they need to know that if I do this, this is what's happening inside of my brain. This is what's happening and how I can change and rewire my network. So all those techniques there's beautiful techniques within CBT, dialectical behavior therapy, ACT, psychotherapy. The problem, however, I think you've identified, and as I said, this is a statement I'm making for discussion, is that it tells us, it makes people aware of their issue. And then there's, okay, do this. This is what's wrong. Now do this. But the in between, the processing and the taking responsibility, not in a negative sense. If you're a victim of responsibility, but it's you are in charge of how you want to move forward. It doesn't excuse what's happened. That's terrible, but it's you, the one who has to choose to take that and those steps to actually process. So it's one thing to know, but you need to know the root, and you need to know the impact of the root, and then you need to know, how am I going to move forward? And you said so beautifully that if they go to these sort of traditional type therapies in the way that you would train and I was trained, it becomes a revolving door where you rehash. You said it perfectly. You rehash everything. You get it all out. Certainly you're going to feel better and you're going to get some perspectives from the therapist, but it brings a lot of stuff up, and that becomes a revolving door, because then maybe you journal it all. You're saying the same thing over and over, as opposed to, okay, this is the problem. Let's get it out now. Not just talk about that. Don't get stuck in that revolving door. Let's evolve and let's move forward. And that's what I try to show with the research behind the neurocycle, is how do we get from getting it out, moving from revolving door into evolving. What do you think? That's just some thoughts that
100%. And it's interesting because I did have the tools, but I didn't have such a clear, scientifically evidence base to actually rewire the brain. And the formula to be able to do that with my clients. You know, clients that came in and they go, "You're a different counselor." And I said, "Yes, because I'm not going to get you just to talk. We're going to actually do the work." And the first thing I ask is, do you want to change? Is this something that you actually want? And I've even had people go, "I don't know." I said, "Well, let's look at that. What is, and it's about being scared to change." But they didn't know how to change. They knew something is there. And you're right about there was this piece missing in the middle that when they understand things, they're like, "Oh, that makes perfect sense how that really affects how I'm actually in a relationship with my husband or friends, or the way I avoid things, the way that, I shut down." And so, okay, now we have that. Now let's teach you what you do about that. And that's what I really focus on, is that solution focus, so that they can start rewiring and that pathway. Because I explain it. I said, "You have wired it down this, which is so this way, and it's so automatic that you're not even aware." So that's where that awareness comes into play, because if you can't be aware, how can you start changing it? And so I focus on that by showing, and one of the tools is the metacog and the 4 warning signals. Those are 2 things I use continuously. I used to do, how you take an intake, this as an intake, and their information. Well, I actually start using a metacog
from the beginning.
Yes, as remember the genograms, you have to do the genograms. Well, I use the metacog to get information of what they're saying. And I plug it on the metacog and show them right away and say, "This is where I feel we need to lead to." And of course, then teaching them the 4 warning signals, and especially, as you know, and I want to get into that about the trauma, but where your body sensations is a huge warning signal that you need to take note, because it's actually sometimes starts there, I believe.
Oh, I totally agree with you. And you've said so many important things, and I'm trying to think of all the things that I want to emphasize of what you've said, which is so fantastic. But one of the things, we're going to get into the metacog, we're going to talk in depth about the warning signals, and explain that. But Dawn, you and I have had this discussion before, and I'm just going to prompt you, because you and I have had lots of discussions.
Yes.
The order of, we can think of, people become aware of things. That's what I found when I was practicing. I don't practice anymore. And I also, by the way, when I did my intake, always on a metacog, and then you could show the client. But there's a lot of chaos in this emotion there, and that sensation there, and do this technique there. It's kind of like all these things that we teach, or not even, yes, educate and empower people with, in terms of the work I both do. It's organized chaos. So it's taking all these things. You don't just think of an emotion and then boom out another one, and then a bodily sensation, and then do a technique, and then a process.
No.
It's order. Rewiring the mind-brain-body connection is very orderly. And that's one of the things that I found with carryover. I did a lot of research and things on carryover. And if you don't get nice order, you don't get good carryover into the person's life. Is that something, I mean, I don't want to you can contradict anything I say, but is that something that you have found in your work as a counselor, that in terms of the bringing order out of the multiple
chaos?
They come in and they know, they may even know the cause of why they are functioning. They probably can describe to you, "I'm doing this and this and this, and this is why," but they seem to get stuck there. And then it's all over the place. I don't know if you want to talk to that.
No, that is absolutely correct. Yes, I do. And by the way, before I get more into that, I love the title of your book, because that is actually what we're doing for our clients, right? Cleaning up the mental mess, because it is so chaotic. So if we come and approach them with a chaotic approach and go, "Oh, you need to do this, you need to do,"
it's too much.
And it overwhelms them actually too. And it's not productive in changing. So showing them even how to gather, and reflect, those 2 steps is really important so that they become, okay, more clear in their mind, and then be able to put it onto the page, which by using the metacog gives them, it's first they go, oh my gosh. But, in my counseling and as a facilitator, that is my forte, is I look for patterns. I help them to look at, hey, what emotion, right? Okay, let's look at your emotion. Well, where's your perspective and behaviors that could be attached to that, as well as the origin of the emotion. And that just alone starts to give them clarity and starts to, like you said, bring in some structure into the chaos. But the most important part, which I feel, and is the recheck and the active reach.
Right.
Because the recheck is the part that you are starting to find a solution to be able to reconceptualize all that chaos and start focusing on the things, that even little steps that you can do that will bring you forward, which empowers you versus whatever's happening going on you, which disempowers you.
So good, so good. And that's also, just as a side note, the active reach is where you can bring in the CBT and ACT type techniques. That's and the journaling and that kind of thing. That's where you do it. If you've done the prior steps, then it works for you. Otherwise, it can keep you stuck. But if you put it in the right place, it's brilliant. So that's
It is brilliant. And the active reach, I emphasize that on everyone, is you need to do that, because that is the process of reconceptualizing. And, with your program, the first, 21 days and I tell them, okay, this isn't going to feel great, which is okay, but we're uncovering all of that and which is all that mess, bringing it up to the surface. We have to look at that. We have to see what's underneath so that we can start reconceptualizing and look at the places that do need to be changed, and then be able to stabilize that new reconceptualization of what happened to you and where you're going to go forward. And so I truly believe that.
That's such a great way that you've explained it. A quick question in terms of sort of traditional counseling and therapy, and how now incorporating this into your practice. Do you find that this process of the first 21 days is quite difficult, because you're facing all this stuff and it's up and down, and then having that whole idea of the first 21 days, the second 42 days. And for those of you that don't know what we're talking about, in a moment I'm going to ask Dawn to walk you through the 5 steps and to give an example, and she's got an amazing thing she's going to work us through so you understand it. But just in terms of helping the clients to be able to say, hey, there's a pathway, there's a healing journey that I'm walking.
Yes.
Has that clarity, does that clarity help your clients or not?
Oh, immensely, because they can actually see it. Before they knew it was there because it was coming out of their behaviors or their emotions, or the way that they were interpreting the world, or the way that they, the shoulds and the personalizing and those things. Now they understand, oh my gosh, okay, it doesn't feel good and I've pushed it down. And I said, you push it down and you've suppressed it, but I'm sorry, it's actually coming out like an alien sideways because it's there, right? It is there. It is there. You're just not aware that it's there. You're aware that you have these intense emotions and you can't control. But then what do I do and how do I, go from there? So yes, immensely. Also, I want to talk about, if we can go into the trauma part.
Please go ahead.
Because what you're talking about is the trauma.
Mm-hmm.
So the other aspect of change that has happened for me as a licensed professional mental health counselor is I've changed my approach to working with clients with trauma.
Wow.
So I have, as you know, and I said at the beginning, I have an extensive training in trauma work. And more specifically, it's called the CBT trauma focused approach. And one of the steps in this approach is that of working with a client is the processing the client's trauma narrative to confront their painful memories through storytelling. Mm-hmm. And so the trauma narrative is a psychological technique that they use to help survivors of trauma make sense of their experiences while acting as a form of exposure to painful memories. This approach, though, is, with enough, their thought is, with this helps them to expose themselves and their memories, which loses the emotional power. Well, okay. So what I found is when completing the trauma narrative story, and they do a three-part story. And so like the first draft is your just facts. Second draft usually is, okay, I want you to go into your thoughts and feelings, but going through the 5 senses. The third draft is usually the worst moments of going through the 5 senses again. What happens is this became very traumatic for my clients, and I began to realize this was not therapeutic or helpful. And so this approach created more intense emotions, especially like your shame, your guilt, your fear, and your anger. And at points, clients didn't want to come back for counseling, and they had more nightmares.
Sorry, if I may interrupt you a second, because just on this neurological side, and there's research confirming exactly what you're saying. Because if you keep looking at it without processing and managing it, it just gets worse. What do you think about the most gross? Sorry, I didn't want to interrupt you. I just wanted to emphasize that point. Go ahead, carry on.
No, and I agree. So more nightmares, more flashbacks, even regression, in their progress. And, I know you can talk more about this issue surrounding the approach that it has on the brain, right? And the mind. And so I stopped using that approach. And I started using I call it a 10-10 timeline, which is we look at 10 positive events and maybe 10 traumatic, but that's as far as we went. And this brought some understanding, but I still didn't have it until I started using your 5-step mind management program, the Neurocycle app, and using the 4 warning signals and the Metacog as a method of, approach to getting more memories, but without that adverse effects on my clients.
And why? Can you explain that? Can you explain why?
Yes, and I will for sure. So
go ahead. You got the
floor. No, that's okay, because I get so excited about this because I see it in my practice. I see it working with the program when people come through the whole Neurocycle program, is that I love how this approach does not focus on the details of the trauma, but it actually looks for understanding on what happened in the past, but how it has affected their lives by taking a closer look at the triggers and the patterns and their perspectives and their body sensations and emotions. It also allows the client to focus on, which is what you and I believe that change happens, is a solution, a positive solution by reconceptualizing. So we're not going into the details of we know that it's happened. Mm-hmm. And this is where I use Dr. Leaf. I call it your power questions. I've always called it. I said, this is Dr. Leaf's power questions, which are so much more empowering for the client. And that is, what can I do about it? Right? What can I do about it? I can't change what happened or what is happening, but right now I can look at this and change how it affects me and plays out in my future. And so I can process that by using the Metacog. If you want to maybe share that Metacog, unless you have something to add.
Maybe just
before.
Would you mind just going through the 5 steps very briefly, explaining them, and then let people know where the Metacog's come in, or however you want to do, whatever way works. If you want to take us through an example and say, like a client that you can, obviously you're not going to name that person or story.
Right.
This is step one, but however you want to do it, Dawn, so that they can get it, for those that have never heard of the Neurocycle, and
Yes.
a brief overview, walk them through, use an example,
Yes.
however
Yes.
you are the most comfortable.
So what I want, how I start is of course is your step, the gather step, right? We're gathering information. And by that is when I start using the 4 warning signals what are your emotions? And we start with their one toxic thought in the middle.
Want me to share that? Would you like the medical?
Yeah. That would be great.
Share it. There you go. Okay.
Perfect. And I'm just going to grab something of mine. Hold on here. Because it helps me. I use the Neurocycle, table. So what we're doing is we're gathering awareness. And by that is I start to say, okay, let's put, and this one I used is I'm not of value, which actually came out of, and where I'll go is their origin. So we started with that. So how I start is, okay, so when you have, correct, when I'm not of value, how does that make you feel? What are your feelings that come in mind? And a lot of times they feel lonely, fearful. And as you notice, I connect, sometimes one emotion connects with another emotion connects with another one. So I kind of did that with this branching out they feel lonely, but at the same time, fearful and sad, but then alienated and rejected. And then I asked them, well, why do you think you feel these feelings? And first off, we look at, the stolen of trust in people. So I feel that I get rejected because I also avoid, which we'll get to the behaviors. And also, the abuse that came into play, or the toxic thoughts that my perspectives keep me feeling these feelings. And so then we go into, because I always feel that their perspectives and behaviors have a huge bearing on their emotions, which through your right. And so what we would do, that's kind of that gathering. So we're looking at some of the perspectives of what are you doing or saying related back to this main thought, I'm not of value, and the perspectives, which is I don't belong, I need to please, I need to be perfect, I am bad, I'm weak, I'm broken, and I'm worthless. And we ask, well, why? Well, they don't feel of value because their past beliefs from their abuse made them feel these and have these, have these perspectives, and which then link into their behaviors. They're more cautious. They suppress their feelings. They isolate themselves. They compare themselves. So all of what we're doing in those two, the gather and the reflect step, the gather step is always the what, what am I feeling? What are my behaviors? What is my perspective? And maybe also what are, what's causing these things, which, as you noted, and also your body sensations, forgot body, because that's really important. A lot of times I can link into their body sensations, which actually helps them to link into their emotions as well. So here is like, I start having butterflies in my stomach. I have heart palpitations, sweaty palms. Well, why? I'm becoming anxious and I don't even know why. And then I start ruminating on being anxious, so we start there. Then the next one is the reflect. This is where we get a little more deeper into, why. And I don't show it here, but a lot of times, Dr. Leaf, is I'll use arrows to start connecting. So when I'm feeling, worried and anxious, well, maybe it's linking because I'm ruminating or I'm comparing myself. And so I link that to each one. So what we do in the reflect step is you're diving deeper by asking and answering the questions like, who, when, where, why, and what. We've done the what questions into related back to the main thought, which is the toxic thought. I'm not. The other aspect that comes into play is we start looking at their origin of what maybe fed that toxic thought, I'm not of value. This is where now we're talking about trauma. This is what I do. So as you notice, I put down here, uncle, there's sexual abuse. Dad was an alcoholic. There was physical abuse, and he left. And then mom, maybe the lack of emotions and didn't protect me. So what we start doing, and what I would do is, and I didn't do it on here, but I always say I have the main metacog, but then let's take the uncle's sexual abuse. So I would take that arm and I would do I'm not a value in the middle. And I apologize, I didn't bring on that. But what I do is I take that arm and then we look again and go back to gather awareness step and reflect with using the four warning signals again from that actual origin story.
So Dawn, just for those that don't know what the warning signals are, the four warning signals that you gather awareness are the emotions, behaviors, bodily sensations, and perspectives. So what Dawn has done is taken the initial metacog, and then she's gone to the origin story, taken one aspect of the origin story that came up in the gather awareness, and then she starts another whole metacog. This is called a metacog, which is a way of organizing information that actually gets the conscious mind to tap into the depths of the non-conscious, where our wisdom is, our stories are, and it brings it out into the conscious mind. And when that happens, then you weaken on a neuroscientific level. You're making a solid network that's driving you in the wrong direction. You weakening it, and you're being empowered to actually now reconstruct it, because you can't change that the abuse happened, but you can change what it looks like. So that's the metacog is you changing what it. So then Dawn takes another one and she'll start another whole one with uncle's sexual abuse, and then she'll go through this whole thing with all the gather awareness, the warning signals, then the reflection, and so on.
And then we, as you said, the metacog is so important because you can see so much. It is so instrumental for my clients because this is where they gain the understanding. And as soon as they gain the understanding, they go, oh, so then we go into the recheck step, which is really important, which is the reconceptualizing, right? So
so quickly. So we didn't do the steps, the mind, just to specify. Step 3 is the actual where you make the metacog and you are mind.
Right. Yes.
So all the things that you gathered awareness of, you get all this data. If you think of gather awareness as gathering the data through the signals, you start reflecting on why. And then that leads to, as you're putting that down on paper and you look at that, it starts generating a mind storm where you think, okay, what else? And lots of stuff starts coming up. Then you go into the recheck. Sorry, Dawn, I just wanted to make sure that.
No, that's right. I missed that step, but that right step is so
critical.
So critical. And if you do it this way versus, the old way of journaling, and a lot of times when they do journal, guess what they were journaling? Toxic. It was all negative.
That's what I found. My patients would say things like when they learned the system, and I'm interested to hear if you had the same experience. And we get people emailing that aren't my patients, that are people that are just learning the system from my book or the app.
Yes.
And things like the journaling kept me stuck in that revolving door. But the medical doing journaling at the end, not that I'm saying don't do journaling, Dawn and I are saying that, but as you go through the 5 steps, the metacog is not journaling. It's actually a mind storm where you are trying to get the information up from the unconscious. So journaling is a great step for step 5 once you've kind of got more organized. So I'll let Dawn take.
Right, at 100%. And I like this journaling because then you can decide what you want to do about it, which is the reconceptualizing, right? So at the top where I put an R, I said, okay, one thing I can start to do to reconceptualize is I'm going to become more aware of my 4 warning signals, even in my daily activity, in my daily life. And then maybe because of these perspectives that I have, I continue to say I'm bad and I'm weak and I'm broken and I don't belong, maybe I start using the countering of negative self-talk. Like, I want to believe that I am not broken. I want to believe I'm of value, because all of that is starting, which you can use, by the way, in your active reach, is some statements that maybe will help you to reinforce more grace in your life. So that would be two. And then again, what I just said is another reconstructive is I do that mini metacog on the sexual abuse, so that I can start making the connections. And so even making those connections is a start of reconceptualizing things that are going on.
So that reconceptualizing is step 4, which is recheck. So
Check.
Steps, you've gathered this data, you've got some whys, you've got some more data from the writing down, the metacog, the mindstorm. Now you, as Dawn said, that critical question, this is what's happened or what's happening. What can I do now? Not forever. You're not fixing this one neurocycle. You do this for 63 days. This is just one cycle. But
yes.
What can I do about this? So that's the recheck, where you reconceptualize. You look at this differently and you get very practical. What can I do now? As Dawn has said, 3 things you could do. You could start to become more aware of your warning signals. You can use countering negative self-talk. You can do a little mini metacog. So those are some examples. So you're planning in step 4, and then you go to step 5 where you actually do it.
That's right, which is the active reach, which is so important. And I express that with all of my clients. You need to be reinforcing that by when they're using the app, they put in the active reach at least 7 times a day. And so really honing in on changing, like, I think you use this example in week 1 is, feeling is healing. That would be such a great, because what have people done? They've suppressed their feelings. They don't want to feel. So even doing that in their active reach, and of course, linking that active reach to a positive visualization, like of their family or even of a mind that is healthy, or whatever it's, a sunset, sunrise, whatever brings them joy, then it aligns, which is starting the process of rewiring their brain.
Amazing.
And so what I love about it is we didn't go into the trauma of what happened in detail. What we looked at is the outcomes of the trauma.
You identified the root. We didn't ignore the root, which cognitive behavior therapy tends to just say bad thought replaced with new thought, use technique to do that. So, it's bad. Here's the problem thought. Here's what we should be thinking. Here are the techniques to get from there to there. That's too soon. We can do that only at step 5. So what you're doing here, identifying, as you've said so beautifully, the effect, but you're also looking at the root, but you're not diving into, and Dawn, maybe we should say this to the audience, exposure therapy. So this is kind of what we...
Oh, yes.
Yeah. So you don't want to, the exposure therapies where you now go and take yourself back in for a lot of time, like constantly digging, you get stuck in the hurricane. Dawn, would you like to explain a little more?
Yes. And so exposure therapy it can be really good, but I don't feel it is good in relation to trauma. So exposing someone to something gradually, well, you can't gradually expose somebody to traumatic, especially like sexual abuse. And so this process is actually exposing them, honestly. Yes, connecting, because it's getting to the core roots of things of how did this affect how I feel, then affect, like, okay, so I start having a perspective. Well, when I have a perspective, I'm bad and I'm broken. Well, now I feel what? Lonely and sad. Well, when I feel lonely and sad, well, what do? I avoid people. I suppress my feelings. Maybe I become passive. So those are all situations. And then body sensations, as trauma lives in the cells, our traumatic experience. Yes, the mind-body connection. So so linking into those heart palpitations could bring up something, but just accepting it, it's a heart palpitation. So now what am I going to do about that? The deep breathing, which, by the way, that's the first thing I teach all of my clients. And they go, oh, that deep breathing doesn't work. I said, but do you know why you're doing the deep breathing? And I bring the physiological, the brain, and the way that what it does about that part of the limbic system. We need to calm that down before we get back to what?
And
the logical, the wise mind, right?
Exactly. And the oxygen is information, and it bathes the entire brain and body. And when it changes the neurophysiology, so the message back to the mind is that, okay, I'm safe. Right. And that's what breathing is doing. That's why it's so important. And that's why we begin every neurocycle with some kind of breathing or visualize. It's some kind of brain mind preparation. So I'm so glad that up, Dawn. And with that exposure therapy thing, just very quickly, you explained that so beautifully. So what Dawn is saying, you're still going to face the root of the issue, but you don't have to go into and relive every single detail over and over again. You don't have to go to that place and relive every single moment, because that can actually then reinforce it and throw you off in another direction, which is what you said right at the beginning. So here you take what you can handle today, and maybe as you go through the 63 days, and you and I both know, Dawn, when it comes to sexual trauma, one 63-day cycle, which is the time it takes to form a habit, isn't going to fix it. It's going to process. So this is an ongoing thing. I've had some clients who've worked on this for 2 years. It's 12 neurocycles, which is more or less 6 per year if you do the math.
Right.
I don't know if you've also found that this is a time-consuming thing, but you're empowered to work on it yourself. That's the big key thing.
That is the key thing. And so, but saying that, a lot of times after your 63 days, something else comes up that I'm like, okay, this would be, which is, it always attaches back to that core beliefs a lot of times, but it's a different thought, toxic thought that has a grip on you, which is still linked to past abuse or past, your childhood or the way you interpreted things. So then we do it another 63 days, which is just really strengthening that wiring of that brain and the mind and just what you're doing. Yeah.
Dawn, you've done such an amazing job explaining the basics. I mean, it just every time I talk about this, I get so excited, and I love sharing with you. It's just we see, because we see it in action. We've seen it with our patients. We've seen it in our own lives. I mean, honestly, I use this all the time. This is how I get through the tragedies and things that we go through.
Yes.
And the unexpected things that happen in our lives. And so, Dawn, I'm so excited. We've come to the end of this.
Yes.
So quick. Can you believe it?
I can't believe. I know. I could keep on going because it's such great.
It is. It's so great. And we're going to, because Dawn will be back. Yeah. Don't worry, guys. Dawn will be back, and we'll start diving into actual exercises. In fact, send us some questions of what you'd like us, if you'd like us to actually work through full-on examples, whatever you would like. Dawn will be back to chat with me to help us more with our mental health. So, Dawn, thank you so much for your.
Thank you so much for having me, and I appreciate it. And I just look forward to working with many more people on this.
Thank you so much. Dawn's details are inside the app. You'll be able to actually find her details. They're also at our website, neurocycleapp. Oh gosh, we'll put the right link in the show notes where you can find Dawn, neurocycleinstitute.com. Sorry, but we'll make sure that we have the correct links in the details. Dawn's her social media, her webpage, everything will be in the show notes as well. You can reach out to Dawn if you feel like you need to. If you're on the Neurocycle app and you feel like you need a facilitator to help you, Dawn's amazing. She can help you in whichever way you feel the need. So thank you for joining us today. Thank you.
Thank you.
Amazing. It's been absolutely brilliant. Thank you.
Thank you so much, Dr. Leaf.